Welcome to this presentation on patient-centeredness. This presentation is prepared by Dr. Chris Hendricks, a faculty member at the College of Nursing and Professional Disciplines at the University of North Dakota. The objectives for this presentation are to define patient-centered care and understand the importance of patient-centered care. The New England Journal of Medicine defines patient-centered care as when an individual's specific health needs and desired health outcomes are the driving force behind all healthcare decisions and quality measurements. The New England Journal of Medicine defines patient-centered care as when an individual's specific health needs and desired health outcomes are the driving force behind all healthcare decisions and quality measurements. There are certain goals and benefits of patient-centered care. The goals are that patient-centered care is collaborative, coordinated, and accessible. Care should be provided at the right time and in the right place. Care focuses on the physical and emotional well-being of the patient. The patient and family preferences, values, and cultural traditions, and socioeconomic conditions are respected. The main benefit of patient-centered care is to improve the individual's health outcomes. One of the greatest challenges in caring for older adults is trying to provide optimal care for those elderly with multiple chronic conditions. Approximately 50% of older adults have 3 or more chronic diseases. It can be difficult to manage the complexity of the conditions the older adult has. A large barrier for providers caring for older adults can be time constraints. It may take additional time for the provider to involve the patient and their families to determine what the best outcome is for the patient. To assist with the challenges and deal with barriers, providers should begin to recognize that the older person with multiple chronic conditions is facing decisions on what they prefer their care to be. Asking the question, "What matters most to you about their health?" can help the providers focus on what the patient feels is the most important aspect of their care. There are 5 domains relevant to the care of an older adult. They are 1. What are the patient preferences? 2. Interpret the evidence. 3. What is the elder's prognosis? 4. Clinical feasibility. And 5. Optimizing therapies and plans of care. To go into more detail of the domains. The first domain is what are the patient's preferences. Let the patient guide what they want for their care, with shared decision-making with provider and family. Preferences may change over time. The overall outcome needs to be taken into account. The patient should not be encouraged to demand any available treatment without a reasonable expectation of some type of benefit from the treatment. The second domain is to interpret the evidence for limitations of what can be provided for the condition that is being treated and to be able to apply the recommendations to the older adult. Domain 3 is what is the prognosis. The provider needs to inform the elder of the prognosis so the elder and their family and support team can determine what is the best treatment option. Things that should be considered are life expectancy of the elder, is there any functional disability, and what is the quality of life of the elder. Domain number 4 is clinical feasibility. Providers need to consider the complexity of the treatment and whether it is feasible. The last domain is optimizing therapies and plans of care. Using strategies for choosing therapies that optimize benefit, minimize harm, and enhance quality of life. The American Colleges of Nursing have created a model to represent patient-centered care. They refer to it as person-centered care with the person or patient in the middle. The importance of providing patient or person-centered care are surrounding the person. Providing patient-centered care empowers the patient. It can improve the patient's quality of life. It allows the patient to have independence in their care. It can support positive well-being, honors the choices of the patient and their families and support team, and finally it promotes respect. Thank you for listening to this presentation on patient-centered care. These are the references used for this presentation.